recommended that individuals without a prior infection or vaccination stay home for up to 21 days. That letter noted that the Department of Health there is going to defer to parents and guardians to make decisions about school attendance. So we've seen the president of the AAP note that this runs counter to everything they've heard and everything they've read. It's certainly counter to AAP policy. We've seen the chief medical officer for the Association of State and Territorial Health Officials put out a statement stressing the importance of adhering to established public health practices for measles and vaccinating the unvaccinated. Measles is so contagious, it has such a long incubation period that not following those established public health recommendations can allow cases to spread. The CDC has said that unvaccinated people have a 90% chance of becoming infected if they're exposed to the virus. And this is certainly complicated by the fact that a person with measles can spread the virus starting 4 days before their rash appears, so before they even recognize that they have the disease.
Wow, Andrea, so that note from the Surgeon General obviously creating quite a stir. Has there been any fallout since he issued that note?
Well, we're now up to 10 cases of measles in Florida, 9 in Broward County, 1 in Polk County. 2 of these cases are reportedly in children under the age of 4. And while the Surgeon General's letter did not mention the importance of getting vaccinated, we do know that Broward County's local health department has reportedly been offering measles vaccine at the elementary school since the outbreak began. As a reminder, that vaccine has been shown to be 97% effective in preventing infection. There was a Kaiser Family Foundation news article that pointed out that considering the dangers of the disease, the vaccine is incredibly safe. A person is about 4 times as likely to die from being struck by lightning during their lifetime in the US than having a potentially life-threatening allergic reaction to the MMR vaccine.
So we have a virus that's highly contagious. We have a vaccine that is highly effective. Now, one thing we haven't talked about is the, quote, danger of the disease itself. How serious can measles be?
So measles can be serious, and we know it can lead to long-term complications. If we look at CDC's information, an estimated 1 in 5 unvaccinated people in the US who gets measles is hospitalized. Ear infections occur in about 1 of every 10 children with measles and can result in permanent hearing loss. 1 to 3 out of 1,000 children with measles will die from respiratory and neurological complications. And in rare cases, we know that serious conditions can emerge even years later. The most recent CDC data indicates that there are at least 35 measles cases in 15 states reported so far this year. In January, we saw 9 measles cases in Pennsylvania, 8 of them in Philadelphia. If there are no more cases reported there this week, that Philadelphia outbreak will be declared over. Last Friday, we saw both Michigan and Indiana report their first measles cases in their jurisdiction since 2019. And it's been reported that that Indiana case visited 3 hospitals here in Chicago while they were still contagious. Dr. Paul Offit, I think, recently made a point that vaccines have been so successful that few people remember what it was like to live with measles. And he added, don't mess around with this disease. It's not a disease that you want to relive. These cases really need to be taken seriously. We have a safe and effective vaccine for this disease and well-established public health guidance to help prevent the spread.
Oh, great advice from Dr. Offit, a friend of the AMA Update, and we'll look forward to speaking with him soon as well. Andrea, let's switch gears and talk about something that we haven't discussed much lately, and that is long COVID. There have been some new developments on the long COVID front. Can you tell us more about the details?
Yeah, so we have a little more clarity about what may be causing one of the more frustrating symptoms of long COVID, and that is brain fog. We know that nearly 50% of patients who experience long COVID have reported brain fog. And earlier this week, an Irish research team reported their findings in Nature Neuroscience. So those findings suggest that disruptions in the blood-brain barrier along with hyperactive immune system are the likely mechanisms behind brain fog. This is not a new theory, but to test it, the researchers analyzed blood samples to look for any biomarker differences between those who did and did not report brain fog. They found that those who reported brain fog had higher levels of a protein that was produced by brain cells not normally found in the blood, which hinted at a leaky blood-brain barrier. For the second part of the study, the researchers conducted brain scans using dynamic contrast enhanced MRI to examine brain circulation. And they found that long COVID patients with brain fog had a leaky blood-brain barrier when compared to both long COVID patients and then to others who had recovered. They also found that long COVID patients with brain fog had increased levels of clotting markers in their blood.
So, important finding, Andrea. What does it all mean?
Well, it's important to understand those underlying causes of these conditions so they can inform the development of targeted therapies for patients in the future. And I think it's important to note that this isn't true just for COVID. As one article states, the concept that many other viral infections lead to these post-viral syndromes might drive blood vessel leakage in the brain, and it's potentially game-changing. These findings could change the understanding and treatment of post-viral neurologic conditions, and the findings also confirm the neurological symptoms of long COVID are measurable with real and demonstrable metabolic and vascular changes in the brain, which is huge. And I think it also importantly serves as validation for all those who've been suffering from these symptoms of long COVID.
Absolutely. That's a really fascinating study, and we're going to continue to watch as that evolves. That wraps up today's episode. Andrea, thank you again, as usual, for your perspective and being here to keep us informed. If you found this discussion valuable, you can support more programming like it by becoming an AMA member at ama-assn.org/join. We'll be back soon with another AMA update. In the meantime, you can find all our videos and podcasts at ama-assn.org/podcasts. Thanks for joining us today. Please take care. Hello and welcome to the AMA Update video and podcast. Today we have our weekly look at the headlines with the AMA's Vice President of Science, Medicine, and Public Health, Andrea Garcia. I'm Todd Unger, AMA's Chief Experience Officer. Welcome back, Andrea.
Thanks, Todd. It's great to be here.
Oh, Andrea, we have got a lot to talk about, including this first topic that I thought maybe we wouldn't ever talk about again, and that's H5N1, otherwise known as the bird flu. Andrea, why is this making headlines this week?
Well, Todd, earlier this week, we saw Texas health officials report that an individual who'd been in contact with dairy cattle contracted H5N1. H5N1 is a type of influenza virus that causes highly infectious and severe respiratory disease in birds. That's why we call it avian influenza or bird flu. This is only the second human case ever reported in the US, and it's the first case that we've seen that is linked to cattle. There was a statement released by the Texas Health and Human Services Agency noting that the patient experienced eye inflammation or infection of the conjunctiva, and that was their only symptom. The individual was tested for flu by the state late last week, and then over the weekend, the CDC performed a confirmatory test. That patient is reportedly doing well, is being treated with the antiviral drug oseltamivir, which is sold commercially as Tamiflu. And that individual was instructed to isolate to reduce the risk of infecting others. And to date, there is no indication of the disease spreading further among humans.
Well, that's the question I wanted to ask, just to go a little deeper there. Do we have to worry about potential spread here, or is this isolated?
Well, according to that statement from the Texas Health and Human Services Agency and an article in Stat News, the risk here to the general public is low. In that Stat article, the principal deputy director of the CDC, Dr. Nirav Shah, said the fact that there are not other samples to test right now is reassuring. This means that the CDC is not currently aware of other individuals who are symptomatic following an exposure to livestock. Dr. Shaw was careful to point out, however, that the agency is working with state public health officials to make sure those who report signs and symptoms of illness know how to get tested. As we see increasing prevalence of H5N1 in cows, testing those farm workers and dairy workers is going to be important.
So, Andrea, we got one case in Texas, and fortunately, the patient does seem to be doing well. Why do you think this has set off so many alarm bells?
Well, H5N1 bird flu has been of concern to health experts for decades. I think the concern here is as this virus spreads to mammals, it could make it easier for the virus to infect humans. And over time, we've seen nearly 900 human infections across 23 countries. Just over half of those infections were fatal. And up until now, cows have not been on the list of animals that have known to be susceptible to this virus, but this virus has been detected in other big mammals, big cats, bears, foxes, skunks, and seals. And in recent years, the strain of the virus found in many parts of the world, including the US, does seem to trigger human infections less frequently than earlier versions of the virus did. And when human cases caused by this strain do occur, they typically are mild. However, that could change if we continue to see additional mutations.
Absolutely. Well, at least that's a piece of good news. Andrea, what does this mean for our dairy supply now that it's been found in dairy cattle, and has it been found in cattle beyond Texas?
Yeah, so the only known person infected from cattle is in Texas. There are 4 other states, Texas, Kansas, New Mexico, and Michigan, that have recently reported H5N1 outbreaks in cattle. And Idaho has also reported presumed cases. While the virus doesn't kill the cattle, the milk production is lower and the animal feeding is reduced. Owners of those implicated herds have been told to destroy the milk product from those infected cattle. If milk from the infected animals did make its way into the food chain, the CDC said that the pasteurization process could kill the virus. As of now, most experts believe that risk of H5N1, that the risk it poses has not changed by the infection of cattle, but this is something that we'll certainly continue to keep an eye on.
All right, excellent. Well, last week we were also greeted with another health alert from the CDC. Andrea, tell us more about that new alert.
So the CDC issued a health advisory, or a HAN, last Thursday, and that was in response to a rise in rare but severe forms of meningococcal infections in the US. And these bacterial infections can cause potentially life-threatening inflammation of the membranes around the brain and spinal cord. To put this into context, the CDC says that 422 cases were reported in 2023, which was the highest annual number we'd seen since 2014. Of the 94 cases that have a known outcome, 17 of them died. Now, since March 25th of this year, 143 cases have been reported to the CDC. That's 62 more cases than what was seen over the same time frame in 2023. So we're well on our way to surpassing last year's numbers. I think the spike is also notable in that it's disproportionately affecting certain populations.
Well, tell us more about that. What are those populations, and what do physicians need to know?
Well, physicians need to know that invasive meningococcal disease can affect people of any age or demographic group. The current increases in disease are disproportionately affecting people ages 30 to 60 years of age, Black or African American people, and people with HIV. The CDC also noted in the HAN that infection may present with unusual symptoms. So typically symptoms of meningitis infections include fever, headache, a stiff neck, or aversions to light and nausea. However, the reported cases don't have these symptoms. Instead, about two-thirds of the patients have bloodstream infections, and about 4% have had septic arthritis. Immediate treatment with antibiotics is critical in these cases because initial symptoms can get worse quickly and they may be life-threatening within hours. And it's also important for physicians to help ensure that people recommended to receive meningococcal vaccination are up to date on their vaccines.
All right, excellent. Well, turning our attention to another bacterial infection that's also been on the rise, tuberculosis. We certainly haven't heard about tuberculosis in a while. Andrea, what do people need to know there?
So TB cases have increased year over year in the last 3 years following a nearly 30-year decline. And according to a CDC report, tuberculosis rates in the US rose by 16% in 2023. As you know, TB is a bacterial infection. It can attack any organ in the body, though it usually attacks the lungs. Some people don't develop symptoms after infection, which is referred to as a latent TB infection.
Andrea, how widespread is the problem, and do we have any sense of what's driving the increase?
Well, 40 states reported increases in the number and rate of TB cases in 2023. Case counts increased among all age groups and among people born in the US and non-US born people. The CDC report did say that the US still has one of the lowest TB rates in the world. The increase in case counts here in the US and globally is likely due in part to the COVID pandemic. We know that during the pandemic, staff and resources for TB programs were diverted to deal with COVID. That caused timely diagnosis and TB treatment to suffer, and disruptions in healthcare access that occurred during the pandemic also played a role. I think we're all going to need to work together, both domestically and globally, to renew our progress toward TB elimination.
Absolutely. And keeping with this week's theme, I guess, is another disease that we haven't talked about in a while, and that is Mpox. Andrea, what's the story there?
Well, unfortunately, Mpox cases in the US are almost twice as high as they were at this time last year. And according to CDC data, there have been more than 570 cases reported this year, and that's through March 28th. If we compare that with late March 2023, there were fewer than 300 cases. So transmission rates are far below the levels we saw from 2022 when we saw the outbreak where there were tens of thousands of cases here in the US. However, vaccination rates are low, which is leaving people at risk.
Absolutely. Andrea, along those lines, then what do physicians and patients need to know right now?
Yeah, so as you may recall, Mpox typically spreads through close contact. That includes intimate or sexual contact with a person with Mpox, as well as through contact with contaminated materials. One of those most common signs of infection is a rash on the hands, feet, chest, face, mouth, or near the genitals, and other symptoms near those of respiratory illnesses. So think fever, chills, exhaustion, headache. The Jynneos vaccine is recommended for those age 18 and older who are at risk of Mpox infection. And Mpox vaccination should also be offered as PEP, or post-exposure prophylaxis, after a known or presumed exposure. That vaccine consists of 2 doses. It may be given subcutaneously or intradermally under the FDA EUA, and there are currently no recommendations for an annual booster for that vaccine. Locations offering the vaccine can be found on the CDC's website.
All right, well, before we close out, let's finish up with the latest news about measles. We've been speaking for the past several weeks about outbreaks in the US. Are things looking any better?
Unfortunately not. According to data from the CDC as of March 28th, there have now been 97 measles cases in the US. That far surpasses the 58 reported cases in all of 2023. There have been 7 outbreaks, which are defined as 3 or more related cases so far in 2024. 72% of cases are outbreak associated, and 53 of those reported cases are here in Chicago. The number of cases is still lower than it was in 2019. That year, there were more than 1,200 reported measles cases. Still, I think this milestone serves as a reminder that measles remains a persistent threat to public health, and getting vaccinated continues to be important.
All right, well, we've covered a lot of ground in this episode, Andrea. Thanks so much for being here and keeping us up to date. If you found this discussion valuable, you can support more programming like it by becoming an AMA member at ama-assn.org/join. We'll be back soon with another AMA update. In the meantime, you can find all our videos and podcasts at ama-assn.org/podcasts. Thanks for joining us today. Please take care.